All right, well, thank you for joining us this afternoon. Council President Brian Beggs and Dr. Bob Lutz, Health Officer with the Spokane Regional Health District, are with me today to discuss the community's COVID-19 response. We have reviewed the directives from the governor today. We've also been in contact with the Regional Health District throughout the day regarding current guidance for our community. I've also just come back from a briefing with Washington State Department of Health regarding the steps that are being taken right now to limit the spread of coronavirus in our state and in our community. Spokane is fortunate not to be realizing the extent of the impact that other communities in our state and around the country are experiencing right now. While we are not there yet, we are stepping up our efforts to do our part to limit the spread of the virus to and within our community. It is important to note that Spokane County does not have a confirmed case of COVID-19. Based on the guidance that we are receiving, the impact or the important part of that statement is yet. So we will have the opportunity to be proactive. As a city, we are collaborating with public health experts and also learning from the experiences of other communities. Based on guidance from federal, state, and local public health experts, we are urging everyone in the Spokane community to take immediate steps to practice social distancing. That includes maximizing telecommuting options, embedding social distancing into organizations by postponing non-time-sensitive meetings or conducting them virtually, and minimizing the chances of exposure to anyone with weakened or compromised immune systems. We are continuing to gather information from health experts and other state and federal officials, and at this time, we have not established limitations. Again, we have not established limitations on large social gatherings that is right now occurring in King, Pierce, and Snohomish counties. Now, that could change in the coming days, and we work with our government and public health colleagues to do what is best for the Spokane community. At this time, we are urging organizers of large social gatherings to review their contingency plans for postponing or even canceling events of 250 or more people. The city is leading by example when it comes to large social gatherings. We have already postponed employee and volunteer programs that were scheduled this week out of abundance of caution and as a good practice to eliminate any unnecessary potential exposures to our employees and also to their families. We are actively evaluating other upcoming city-hosted events. Additional information about the status of non-critical events will be announced in the coming days. We will keep you updated. The city is following the State Department of Health and their non-pharmaceutical interventions matrix in characterizing its level of response. At this time, Spokane is at a level 2 of the state's 5 identified levels. What does that mean? That means that at the direction of the Spokane Regional Health District, we are operating under voluntary isolation and quarantine for those who are exhibiting cold or flu-like symptoms. Spokane is a community known for events and festivals, and we will take the steps necessary to protect our community and the long-term health of those events. Now, this could include consideration at some time of an emergency declaration, allowing the city the flexibility to take any and all additional steps necessary to protect the public's health. Facts that we are considering are the following: evidence of COVID-19 that is present in our community, a pattern of community transmission in other cities, limiting the spread of the virus to those with compromised immune systems, emerging guidance from other governments and public health colleagues. As a city operation, I'd like you to know that we have issued the following guidance to our own city employees. Avoid unnecessary travel and cancel or postpone non-essential meetings, conferences, workshops, and training sessions. Arrange for our employees to work from home or work variable hours to avoid crowding at any one workplace. If a face-to-face meeting with people is unavoidable, minimize the meeting time, choosing a larger meeting room, and to sit at least 6 feet away from each other. Avoid shaking hands and hugging. We are making arrangement for employees to work remotely if possible, while also maintaining the ability to provide critical public services. We are asking the public to save the trip to City Hall by utilizing the city's online payment and permitting options or visiting us online at my.spokanecity.org or through My Spokane 311 app. This is, and I can't say enough, this is a developing situation. We expect additional information and updates over the next couple of days. At this time, I'd like to invite Council President Breean Beggs to the podium, and also after that, Dr. Lutz from the Spokane Regional Health District with updates.
Thanks so much, Mayor. And yes, I just want to assure everybody that City Council is, of course, taking this as seriously as it deserves to be taken and as everyone else is taking. Many of us have family members who are in the most vulnerable population, and we are finding our role in it. Mostly for City Council, our job is to use our budget authority to whatever the mayor needs in order to fight this as it's going on. And secondly, to ask questions of all government entities and find out what is the plan, what's going on. And so we are fielding your phone calls and your emails and doing our best to get that information out along with the administration. In Washington, there is a remarkable power and really a responsibility for executive function to deal in a health crisis like this. And we fully support the mayor in what she is doing and what she needs to do that, and we will stay tuned as things progress. We are also convinced that it is only a matter of time before there are confirmed cases here. And we're hoping that the weather gets warmer and it fades out, but that's just a hope, and we will take whatever we need to do. I will just note that I am committed to following the science on this and what the recommendations are from our local regional health district that Dr. Lutz will be bringing forward to us. I've served on the health board for 4 years, including as president, and with Dr. Lutz, first as a board member, and now he's the health officer. And with regards to social distancing, I'm just encouraging people to listen closely and pay attention as it evolves. What are the requirements and the recommendations and following them? That is what we can each do for each of ourselves, our families, and our neighbors. And with that, I'll turn it over to Dr. Lutz.
Good afternoon. Thank you, Mayor. Thank you, Council President. At this time, the risk of novel coronavirus, otherwise known as COVID-19, in Spokane County remains low. With the lightening of CDC restrictions on COVID-19 testing, we are now seeing more providers able to use their own judgment to request testing for people who have symptoms similar or consistent with COVID-19. And we at the Health District will no longer be informed about every case under investigation, unless specifically it requires public health action. We will be informed of all test results that come back positive, however. These tests will be posted at our website, srhd.org. Other than ensuring public health is the foremost consideration when making a decision, there are no hard and fast rules about holding public events during a pandemic. We are meeting regularly with local community leaders and government officials to determine when and if we'll need to recommend the closure of public events and gatherings. At this time, we are reviewing events on a case-by-case basis, taking into consideration a couple of factors to include the attendees and their age, where they are traveling from, and then analyzing the risk of both them and to the public. Today, after consultation with colleagues at the State Department of Health, we recommended this weekend's Washington Middle School Basketball Championship to be held at the Spokane Convention Center be canceled due to the number of attendees who will be traveling from high-risk regions in our state. Other events, such as this weekend's Chiefs hockey game at the Spokane Arena, will continue. Recommendations are changing day to day as we receive more information and as COVID-19 becomes more prevalent in the county. For other smaller events taking place in our community, as previously mentioned, special actions are recommended. These include, for example, offering additional hand washing stations and or easy access to hand sanitizer, having staff open and close doors for attendees and visitors. Importantly, have communication throughout the event that encourages good respiratory hygiene, sanitizing high-touch surfaces before and after events, and importantly, pre-event correspondence with attendees that reiterate increased health concerns for people, especially those who are at increased risk, such as those who are over the age of 60 or with other medical problems. And importantly, as the mayor said, it's important for all organizations to have contingency plans. We should be preparing for COVID-19 in our community. Future decisions about canceling events, closing businesses and schools are being discussed with the policy committee that meets tomorrow. On that committee includes public health, emergency management, healthcare partners to include hospitals, EMS, fire and law enforcement, school districts, tribal councils, Fairchild Air Force Base, the City of Spokane, county commissioners, and Greater Spokane Incorporated. In addition, a working committee consisting of many community organizations to discuss impacts of decisions, gather community partner input, and look at long-term actions. They will also be looking at how COVID-19 in our community might impact some of our most vulnerable populations. Importantly, any community-wide decisions will be widely publicized throughout the media. More guidance information on our guidance for community events and venues, as well as for multiple other sectors in our community, can be found at our website. And if you're holding a community gathering or event or want to discuss proceeding with the health district, please contact us at, again, srhd.org, and talk with one of our epidemiologists. Thank you. So at this time, are we opening it up to questions?
For you, Dr. Lutz, I know that we spoke prior to going on camera about those CDC tests. Does Spokane Regional Health District have any of those tests from the CDC?
So the question around test kits, I think it's a little bit of a misunderstanding. If you go to your doctor, for example, and you have a sore throat, he or she can do a quick throat swab and tell you in a couple of minutes that you may or may not have strep throat. These test kits are actually done by laboratories. There's multiple reagents. And so what you can do is you would go to your provider, and based upon his or her decision as to whether or not you met criteria for testing, then he could perform the appropriate test, send it to the laboratory, and then that lab specimen would be sent off to a variety of different sites. So for example, currently in our community, LabCorp, Quest are online to be able to take those specimens and send them for testing. Also in Washington State, University of Washington and the Public Health Lab are available for testing. But again, I think to kind of dispel the concept that you can go in to see your provider and have and be tested for COVID-19, that does not exist. You will not get a turnaround time of minutes.
Mayor Woodward, how will this impact public transit? Are there any precautions being taken there, extra cleaning of the buses, that sort of?
I just spoke with STA today. I believe Brandon is here too from STA, and he could maybe speak even more specifically on that. But they are doing evening sanitation and cleanings of all the buses, and posting also best practices on buses. Right now, I don't believe there have been any public transportation systems anywhere that have been restricted or limited in any city so far. So does that sound about right, Brandon?
Mayor Woodward, another question for you. Out back east in New York, New Rochelle, governor there just basically put a mile-wide quarantine area. If COVID-19 were to become a problem here in Spokane, in an isolated area, would you consider also putting a kind of an umbrella like that?
Well, I have an internal team. We're meeting daily. And if it gets to that point, we'll have that discussion. But we're not ready to talk about that right now.
Is there anything, and this might be further off, but I'm wondering if there's anything that you're doing or discussions you're having in terms of preparing for ameliorating the economic impact that the downtown businesses and other businesses might suffer as a result of the social distancing?
That is part of our discussion for sure. And that's why we want to be very careful and very measured about what kinds of events we're talking about. Having those organizers think about possibly canceling. So that definitely will have an economic impact.
And even right now, the NCAA tournament was announced that they will not have fans. Lots of hotels, restaurants in the area have already been preparing for that, hiring new staff. Have you been talking with those business organizations?
We've made many, many phone calls, and we do understand that there is going to be an economic impact for sure. How great that is to be seen. If we can, but the whole being proactive, we're in a great position to be able to do that because we don't have a case yet, and being able to, when we do, it's a matter of when, not if, being able to slow the spread and keep that bell curve from being as flat as possible. And that takes longer to do, but we'll be better off in the long run.
what kind of contingencies are being put in place with regard to the homeless shelters? Which,
I'd like to have Tisha come up, Tisha Danzing from CHHS, and I know that they've also been doing some training and things like that, so she could talk about that.
Great question. Thank you, Daniel. So a week ago, we brought all the shelter providers together with the health district to do some early training and education and to try to mitigate some of those impacts. We're also doing a weekly homeless service provider incident management team meeting. That's more than a dozen homeless shelters and service providers that are coming together to coordinate around what could happen and to do some contingency planning, as well as do some baseline assessments of what is available, hygiene and sanitation, and ability to expand or change service levels. We're working really closely with King County and with our Department of Housing and Urban Development counterparts in Seattle to try to help learn lessons from what's going on around the country, specifically in King County because they are our closest counterparts, to try to mitigate any of those risks.
if there is theoretically a person at the House of Charity staying in the shelter comes down with COVID-19, what would be the response and how would the city move to deal with that?
Sure. So we're looking at locations to do contingency shelters for isolation purposes, working with those partners to see where we could flex capacity at other shelters, where there might be open space somewhere else for that isolation shelter space.
Mayor Woodward, another question for you, and Council President Beggs, I'm sure you can answer this one as well. Is there emergency funding available to help businesses in case the economic impact of COVID-19 here is severe?
That currently, no, as far as the city is concerned. I know the state is looking at it and the federal government is looking at it. We're a little farther behind that. So we don't have a specific allocation or a plan. I did meet with government affairs from the Washington State Hospitality Association yesterday, and sadly in Seattle, if you're following it, they've really had a substantial drop in business at restaurants downtown, hotel vacancies. I was at River Park Square doing some field work today. The Taco Del Mar said they had plenty of business today, not so much yesterday, but the people ate and cleared out quickly. So I'm imagining that is going to happen, and we're just going to have to assess. But I think the city response on that level is going to be far below the federal and state level, and our job is really to align and coordinate with them.
What about schools right now? I know that there's been no cancellations planned, but what about schools here in Spokane? What kind of measures is the school district taking right now in order to provide kind of a safety net or a clean place to go to school?
Do you have any specifics?
No, I don't.
Yeah, so obviously the school district is separate from the city. It's a huge impact. If you have children in school, you count on them being supervised during the day. And so even if you're able to come to work, you may have to stay home for that. So that's a huge thing, and we haven't heard yet. I just sent an email out to the Department of Emergency Response at the county asking for exactly those questions: the jail, the schools, homeless shelter. What is the plan as we hit trigger points? And I think that's what people want to know. I know there are people meeting and they're making plans, but it's a challenge sometimes to get that out. It's always a balance. Are we going to scare everyone? But I think I speak for a lot of people. Yeah, I just want to know that there is a plan. So show it to me so I know that it exists. And I'm happy that the administration is moving aggressively to get those people together and work on the plan. But whether it's a public facilities district or the NCAA or school districts, we as a city don't control a lot of what goes on. The mayor's office does have some power, and I know she's been briefed on how to exercise that and what might trigger that.
And again, right now, that's all recommendation, but that could change.
Do you have a sense for what factors have protected Spokane, given that Seattle is rife with this disease right now?
So it would only be a personal opinion. I don't know if the doctor
say
wants to
that's
talk about
fine.
it, but Seattle is very cosmopolitan, lots of international travel. We're a little bit less, and I think from listening to the doctors on the radio that I listened to, there was this delay in doing what they call sentinel testing, and if they had had that, really, they might have isolated it more quickly and not had this community spread before they did. And because we're farther back on the penetration of it, we have that opportunity to be a little safer.
Can you guys provide us with an update on the 2 patients at Sacred Heart? Have they been released, or is testing still pending?
At this time, I have no new information that I can share with you. I know that they are getting tested on a regular basis, but I do not know their status with respect to those test results.
Dr. Lutz, are you encouraging medical providers to increase sampling for testing so that we can get what Betty was talking about with sort of a sentinel idea of whether it's in our community yet or not? Are you in conversations with our providers on that?
I am, and thank you for the question. Yeah, I think it's important for us to understand that it is here. We just don't necessarily have documentation that it's here. And so until we have those documented tests, it's really sort of, throwing a dart at a board and sort of guessing where it's going to hit. And so I think it's really important that providers judiciously use their clinical judgment to test. That said, I'm also concerned about over-testing, because again, I think if we have a lot of runs on people getting tested, we've already talked about a lack of, for example, the viral reagent that's used and the transport medium. And so if, again, we have an inordinate amount of tests, it's going to be difficult for me to really get a sense of the degree of illness here in the community. So it's a balance that we're trying to strike. But again, I'm certainly encouraging, now that the CDC has liberalized its testing criteria, definitely test individuals who you are concerned about that being a concern.
When you say it is here, we just don't have documentation, you're referring to somebody in Spokane County, in the city of Spokane, probably has the virus already, just hasn't been tested.
I think statistically, yeah. I mean, as both the mayor and council president said, we talk about yet, and we talk about a yet confirmed case. But just statistically, if I have 36 states across this country currently with disease, and a short time ago I had none, we're seeing this rapidly spread. The World Health Organization declared it a pandemic today. So they admit that this is of worldwide significance. So I have no doubt that there are people walking about asymptomatic or minimally symptomatic in our community that have it. That's why, as was asked, the sentinel testing for us is really important. Because then once I know definitively that I have it, it sort of changes the dynamic and it changes the calibration of the efforts that we're going to be putting forth to really prevent its spread.
Do you think affordability is a concern? Do you think people might not get tested because they might have to pay for it?
In some situations, I've heard of organizations that are actually waiving the fees for that testing. I know we've been asked whether or not there'll be federal funds and or state funds to support that testing. I do not have an answer on that, but I know some organizations are saying that we will test and not charge you for that test.
So what's your advice for somebody who finds out and just, has an inkling that I actually have this virus? How should they just go home and lock themselves up for 2 weeks, or what should they do?
Yeah, so the current guidelines are that if you are diagnosed with COVID-19, then you are essentially putting yourself on self-isolation. And again, the difference between isolation, meaning you have the diagnosis, versus quarantine, you may have been exposed to someone who has a diagnosis or potentially you have it. So you're putting yourself on self-isolation and restricting yourself and access to other people. And when you are released from isolation, it's when you've been fever-free for 72 hours, off of all medications, or have been symptom-free for 7 days, whichever is longer.
Mayor, can you explain the scope of your authority and what threshold we need to cross for you to enact that authority for access?
I think we're pretty much there. I think the governor gave that to I think Dr. Lutz is the Spokane County, and then I have that authority with the city. But our efforts are always to align, though, between the city and the county.
But you could theoretically order an event canceled
Yes.
tomorrow.
All right, thanks, everybody. This time.